China says that it will stop reporting asymptomatic cases of COVID-19 as they are impossible, really, to track. It's another step in the dismantling of Beijing's zero COVID policy. Now, this major U-turn is bringing with it a wave of illness. The World Health Organization is warning that China is facing tough times ahead.
Scenes like these were hard to imagine in Beijing just a few weeks ago. Parents and sick children crowding corridors at this paediatric hospital. But scrapping China's strict COVID restrictions has come at a cost, and waves of illness are now spreading through the city. Lengthy queues forming at clinics and demand for medication skyrocketing. This pharmacy among many to have run out of flu medicines and COVID tests.
The impact of opening up is still being felt, but this is the price we pay for being freer. It feels like it is convenient to go out and go to places. But for myself, I must be more cautious because there is no protection for us outside. Now it is essential that we improve our awareness in self-protection.
The queues are in stark contrast to Beijing's eerily quiet streets and shopping centres. Illness has been hitting workers hard, and a shortage of delivery drivers means packages are piling up. The past week has seen a massive transformation in China's COVID management. Domestic travel has opened up, positive cases can isolate at home, and the government has scaled back its tracing and testing. Now authorities are scrambling to react as the virus spreads.
More than 14,000 fever clinics have been opened in hospitals, and more than 33,000 clinics have been set up in community healthcare institutions.
Infections are expected to spread across the country in the coming weeks as people who haven't been able to travel return to hometowns and villages. The World Health Organization warning China faces a very tough and difficult time as it adjusts to living with a virus that authorities tried so hard to stamp out.
Well, my next guest is Shi Shen. He is an associate professor of health policy and economics at the Yale School of Public Health. Professor, it's good to have you on the program tonight. Much of China's population, we understand, lacks immunity because so many have not been infected with COVID-19. As the government eases this zero COVID policy, are we going to see an explosion in COVID cases, and are we going to see an explosion also in fatalities?
Yes, we will see a surge in the cases as many other parts of the world has been experiencing. What drives China's healthcare system more strained is its underinvested primary care system. So when people are having any illness, they go to the hospital, which may easily crash the healthcare system. So we see that the doctors who have been on vacation has been called back to serve, and doctors who are tested COVID positive still need to serve in their own roles. So that will be a tough months ahead for China, especially during this holiday season. China has two holiday seasons. One is the New Year. The second is the Lunar New Year, which are very close to each other this year. So 2 weeks from now, China will be seeing a large flow of population moving from east to west and to return to their home county, home village, which may risk bringing the virus to their parents and older adults. So this is very risky and challenging work. And so China really needs to get things done in terms of vaccinating older adults in the coming 2 weeks.
And Professor, you know, the rest of the world is attempting to return to some sense of normalcy. And we have to keep in mind that here in Europe, but also in North America, when restrictions were lifted and people started living without the mask, for example, there was a slight increase in cases. Is that what China has to go through now? And is it going to be more extreme in China because they had such a strict policy, this zero COVID policy, for so long?
Right, indeed. As you were mentioning, China has been implementing the zero COVID, which protect most people without any exposure to the virus. Even if people receive vaccines, most often their last dose of vaccine was received like 11 months or 1 year ago. So the erosion of the immunity as a result of infection or vaccination is huge. So that will take time for China to get a population level immunity back to a safe level. But during this time period, it's very important to establish a medical triage protocol to keep people safe at home without going to hospital. Only prioritize those resources for those really in need of help and safeguard the health and well-being of the older adults. And so far, China has been very painful to establish such a policy because there was no nationwide family doctor system built before the pandemic.
And let me ask you, as a public health policy expert, when you look at zero COVID, and you see what's happening now with it being lifted quickly and with all of these new cases, what was zero COVID about really then? Was it about protecting people? Was it about sound public policy? Or was it more about a government or a politician, trying to, hold on to power? I mean, do you see, was there more politics than public health in this mix here?
Yeah, I think the key issue is not about zero COVID itself. Zero COVID policy was successful at the beginning of the pandemic when we knew very little about the virus to keep the huge population safe. But as the virus gradually evolved, it's very important to adapt that policy to the changing virus. But China has been very slow in adapting to that, have been maintaining their zero COVID by mass testing, quarantine. But that's very painful experience because that sacrifices economic growth and the social well-being. But this is a sacrifice China planned to buy time to prepare the healthcare system and the vaccination. But we see that over the last 1 year and more, the vaccination campaign was very slow and even came to a halt for the major part of this year.
Yeah. I've got about a minute left, Professor. The economic impact of zero COVID and lifting it now. And we see reports that the streets of Shanghai, the streets of Beijing are still basically deserted. People still don't want to leave their apartments. When is this fear? When is normal, a feeling of normal? When is it going to return?
In the next couple of months, it will be very painful and sometimes chaotic. But in the long term, and it's welcomed by the international community because once China is fully reopened, the supply chain disruption may gradually recover, and the population flu and the talent flu will be like more back to normal. But during the next few months, it will be very painful because China will need to first deal with its looming public health crisis.
Yeah, and some possible super spreader events, and plus the winter. That's a bad combination, as you said. Professor Shi Chen from the Yale School of Public Health, we appreciate your time and your insights tonight. Thank you.